I think one of the hardest things when it comes to when you're first getting into hands, right? And you're not sure about all the different diagnoses that you see, that it's problem solving and decision making. So, for example, like we want to create like a framework in which you think about, you have a framework in which to think about things, right? So let's say, for example, we have a hand laceration. Sometimes you don't even know what you're getting until they come in to your office, right? So I got a text message, got a hand guy, can your therapist make a splint for him? And I was like, yeah, sure, you know, what is it? You know, oh, it's we need an MP block. But an MP block could be anything. So we have an MP block. It's a hand injury. Dude, can you get any more vague? What do I block? Just an MP? What do I let free? You know, what else do I block? And so this is essentially this information that I got.
And in what direction? That's what I was going to say.
Right, what direction? So, right. So then you're thinking, what are the questions that are, you know, going through your mind? What kind of injury, right? What kind of injury, right? MP block? MP block, but, you know, you're thinking, what else is blocked? Or free, right? In what direction? What direction, right? So let's say, for example, you couldn't get any more information. I was able to text her and be like, okay, well, you know, what did he have surgery? Did not have surgery, right? So therein lies some other questions. Hand injury, right? But surgical versus non-surgical, right? So these are some things that you want to think about when you have a hand injury. I think the first thing you're thinking about, number one, is this surgery? And did he have surgery versus no surgery? Right? Surgery versus no surgery. And then it turned out he did have surgery. So this was a yes, right? This was a yes. And then, so then it became what kind of surgery, right? What kind? Where? So then here you then, if this is yes, then you have to go into anatomy, right? Then you have to start thinking anatomy-wise. Was it let's go deep, right? Bone? Tendon? Tissue. Right? Because those are the three things: bone, tendon, and tissue. We're talking about the hand, right? So this is a hand injury. First thing that comes into mind is the surgical versus non-surgery, right? You're also thinking, with that, you're thinking, what kind of injury is it? Surgery or non-surgery? If it's a surgery, what kind of surgery and where? Where is the surgery? Anatomy. So you think, is it bone, tendon, or tissue? But you're also thinking, where? Is it volar or dorsal? So in this particular case, he had surgery, but it was tissue. All right, he didn't cut any tendons. He just lacerated the dorsal aspect of his hand. So it had surgery, he cut some tissue and had some stitches on the dorsal aspect of his hand, right? So the hand, it could be anywhere between the fingers and the palm, between the fingers and the hand. This is the actual hand part, this part right here. All right, so we're gonna, this part back here, it was run over by a roller coaster. He passed out. He passed out and his arm went out and it got ran over by the roller coaster. Damn, he was lucky he didn't cut a tendon and crush some bones. Tissue, dorsal. So then you start to think, they want the splint, right? This is what makes it a little bit more difficult because the doctor is calling us saying, we want this splint, right? Just because somebody tells you they want something doesn't mean that you just go and do whatever the hell they tell you. You are the professional. You get to decide based on your knowledge what you should be doing. An MP block for what? You know, is it bone, tendon, or tissue, right? So then how did is it volar or dorsal? So if it's dorsal, I'm going to imagine dorsal that he can't hold his, you know, it hurts here, so he might not be able to move his wrist back. He might not be able to, you know, really make a fist, right? Because those things might hurt. So if those things hurt, he might be inflection and inflection. Fingers inflection, wrist inflection. He came in like that? Just like that? Okay. So, and I thought about that because of anatomy. What's in the back of the hand? If someone got cut or smushed in the back of the hand, everything that moves them in the back hand would bring them up, and so it's going to pull on the tissue. And so if that hurts them, they might not want to pull on the tissue. They're going to put it kind of long so that they don't have to feel it. And then when you make a fist, pulls on the tissue and on the you know, everything there too. So if it's just the tissue and then it's just dorsal, nothing was broken, nothing was cut, what do you think the precautions are? So precautions. What do you think you should be concerned about? Right? Knowing anatomy alone, you should be able to do some critical thinking and come up with some precautions, right? You should be able to educate them based on what you know. You should be able to educate them. He just had surgery. Wound care. Nothing else can happen if that wound gets infected. So wound care is always top priority. You have an incision, you have an open wound. First problem, wound care. Second problem, it just happened. So what would you think? So it just happened. You have swelling. So if it just happened, you're gonna have swelling, and you're gonna have like you can't really move, right? So then you have to look at protection. You look at protection and positioning. Because if you protect it and position it, you could help with edema. You can help with motion. You could help promote wound healing, right? Because if they have lacerations on the back of their hand and their skin is completely tight all the time, their wounds might be too approximate, distracted, right? So they might not be healing as well as it could be. And that's for protection, right? Positioning will help with motion and edema because they're hanging like this and they can't functionally move because, you know, the natural attitude, if your wrists are down, your fingers don't move, then you're going to end up with more edema and with more limited motion. So precautions are wound care, and then you have to think, how do I protect this hand and position this hand based on his injury? Second is, we already know, we had a clue, okay? Our clue was because they wanted a splint, right? So we're not completely isolated. We know they called us and said, we need a splint for this person. So we already, in our mind, thinking, oh, they want something in terms of protection, in terms of positioning. Now, our precautions are that we have to, number one, get this wound healed. Number two, protect and position this hand injury so it has the best possible chance of a full recovery without any complications, right? And we know that we need to do that in what position, right? If there's no, tendon laceration, no bone issues, you didn't really have surgery for bone or tendons, we need to put him in a position that's going to allow him to protect the whatever area is involved and then position. So we want to make sure that we are positioning him correctly. So let's go back. So now we know that we have to make a splint, right? So let's think about the splint here. So here we're going to go and we're going to think about the splint. We know we need to block the MPs, right? We need to, if he's coming like this, we actually need, so this then comes down to how he's presenting. All right, so we had certain ideas in our mind of what kind of injury. Oh, an MP block. We had certain questions. What could be blocked and what could be free and in what direction? So if we didn't know any of this, we could say, okay, well, there's two types of MP blocks. There's a volar MP block and a dorsal MP block. And a volar MP block would position the MPs into extension if it was a dorsal injury, right? So like if it was a tendon or anything, those are MP blocks. Anything that blocks the MP, it's because something happened to the back of the hand. And if it happened to the back of the hand, could it include the wrist? Most likely, because the tendons in the back of the hand involve the wrist, right? This is just like you thinking when you have a problem coming in. And then what else? The other one, MP block, would be dorsal MP block, putting the MPs into a safe position. So that's a different type of MP block. So one is blocking MP from moving into flexion, one is blocking MP moving into extension. So MP block moving into extension might be a bone problem because you want the MPs to sit into flexion, especially if something is broken, if they had pins, or it could be an MP block into flexion because they had a flexor tendon injury. So in your mind, you're thinking, what kind of MP block, what potentially it could be? It could be from a hand-based splint all the way to like a hole from the hand, fingers, hand, wrist splint. So it ranges, right? So you get in your mind what kind of splint, right? So you have different ones to choose from, and then you have to wait to do the assessment. You do the assessment, and then you say surgery, because then he came in, surgery, non-surgery, okay, he had surgery, what kind of surgery, and where? Well, he came in and he presented in a certain way, and the family said, oh, there was no bone, there was no tendon, it was only tissue on the back of the hand, and then you saw him come like this. So then you're thinking, okay, I want to make sure that we take care and educate them on wound, and this is what we're actually doing, protecting and positioning, because they came in specifically for a splint. So then I think, what kind of splint? If his wrist is in flexion, then what happens? Then I need to put his wrist, the splint needs to be into extension. So if the wrist is in flexion, then the splint needs to be in wrist extension, right? Not extension, but you want it to be in a safe position, which is either neutral to 20 degrees, right? So if he's coming in and he's like this, we want to put something that's going to position him into some amount of extension, right? And then if that's the case, then what else is happening? Is his finger is able to move, or the doctor wanted an MP block. So if his fingers are falling and he couldn't extend them either, then that's what they were talking about, an MP block. So they wanted to protect that area in the meantime, because they're saying that maybe nothing is, that they didn't cut anything, but we don't really know. He could have had partial tendon lacerations, and we don't know that. So we're going to say, to be safe, we can do they want an MP block. The doctor wanted an MP block. And now we're saying, well, we want to make sure we're including the wrist, and if we're going to do the MP block, the block from coming into a flexion, we have to include the wrist too. Because if it's too small MP straight here, then he could curl in and that splint doesn't really do anything. So we actually have to cross the wrist here because he's not able to hold his wrist into extension. So we want to, if the MP is flexed, and the splint needs to keep the MP then into extension at 0 degrees. But what's wrong with the IPs? Nothing is wrong with the IPs. So we don't need to include the IPs at all. And we don't need to include the thumb. And we don't need to include the forearm. Right? So then that's how we would think about it. And of course, we are able to sit here and talk about it for the last 20 minutes. But when someone comes in, you get a phone call and they say, I have someone with a hand injury, needs to come in for an MP block. Can you do it? And you're like, yes, we can do it. You literally only have a few minutes to figure out like what is happening. And this is what your brain should be doing to get you prepared for it, the different scenarios. But really at the end of the day, you're gonna ask this hand injury, what kind of injury? Is it surgical or non-surgical, right? If it's surgery versus no surgery, yes or yes, then the questions are what kind and where. So it still comes down to anatomy. Let's say this was a no, right? And this was, this was the answer. He had no surgery, right? So this is a yes. What are you still thinking, right? So if it's not surgery, no surgery, he had a hand injury. Then what are you still thinking? You're still thinking, what kind of hand injury? Where? It comes back down to anatomy. Is it bone, tendon, or tissue? Did he hurt himself on the volar or dorsal aspect? So if it's no, he had no surgery and he had tissue, then what kind of tissue, is it a contusion? Did someone hit it? Was it a crush? But nothing happened to it, right? So still the bone wasn't broken, the tendon wasn't cut, but the whole thing got smushed or got banged into. It's a contusion, but it's still the tissue. So then you're still having the same thing, right? Was it on the volar side? Was it on the dorsal side? Was it both? What are the precautions? Wound care would not be the problem anymore, right? Because you didn't have any wounds. They're asking for a splint. Your precautions are, okay, well, what do we still need to do? We still need to protect and position. What are we allowed to do? We're allowed to start motion, work on edema, and, we don't have to worry about wound care anymore. So your line of questioning, your framework is still along that path. And I think everything comes back down to, asking the right questions, but then you have to know your anatomy to know, okay, what are your precautions? What are you allowed to do and what you're not allowed to do? So, and then if there's a splint needed, then you have a framework for the splint. But it's the same idea of the anatomy. What position is the wrist in? What position is the fingers are in? What's involved, what's not involved? So you can make that executive decision to say, okay, the wrist needs to be in this position, or the wrist doesn't need to be involved. If it was more of an injury to the fingers, and he came in and his fingers were like this and his wrist was fine, he's like, only my fingers, then what you have to think about something else. Your questions here would be different. Your answers here would be different. Your questions would still be the same. Your answers would be different, right? But in this case, he came in, you did the assessment, you found he had his wrist looked a certain way, his fingers looked a certain way, and then you can narrow it down and then make a decision on what gets included and what doesn't get included. All right.
Hey therapy friends, it's Huang here. Thanks again for watching my video. And if you like videos like this that can help you just crush it in the hand therapy world as an occupational therapist, then hit the subscribe button and enjoy the video. Thanks again for watching.